blue light is an electromagnetic field. That's what it is. It's electromagnetic energy. Although it's called blue, you can't even see it. EMFs work like blue light, and they basically directly stimulate the pineal like the blue wavelength and turn off the pineal, shut down melatonin production, and disrupt sleep. And people will sleep lightly, or I have patients that they'll sleep 2 hours a night. It's because they're not producing any melatonin. Why? Well, they were on their computer all night, which gives them from the light, the blue light, but also the EMF, which works like a blue light. And that will disrupt the pineal and the production of melatonin, and it's increasing their cancer risk. There's no question that low melatonin levels are associated with increased levels of cancer, particularly hormone-dependent cancers like breast or prostate cancer. So there's no question that the EMFs are having a profound effect on the pineal, and as a result, a profound effect on sleep patterns. I mean, insomnia is epidemic. The costs of sleeping pills in the U.S. is in the billions, and it's among the most highly prescribed drugs. And what's the reason for that? It's the melatonin disruption. What's interesting is some of the newer drugs like Lunesta are actually trying to mimic the normal melatonin production and encourage melatonin production, because there's a much easier way of doing it, but it's not prescription. You take melatonin. Why take a drug to stimulate melatonin production when you can take melatonin? Or an even smarter way is to try and avoid EMFs, particularly late at night when you want to go to bed, because that's going to have the same effect as blue light and turn off the pineal, stimulate the active centers in the brain as if it were daylight, and you're not going to go to sleep. EMFs can have the same effect as full sunlight, even if you're in a completely dark. You're not going to go to sleep. EMFs can have the same effect as full sunlight, even if you're in a completely dark room. That's why the sleep experts, even conventional sleep experts, tell people if you want to sleep well, keep all the electricity out of your room. Even conventional sleep center specialists, who notoriously are 100 years behind everything, are starting to tell patients you got to have no computers in the room, no iPhone, you can't be on your iPhone. The reason is not only the blue light from the light of the screen, which will stimulate the active centers, but the EMFs work like a blue light and shut off the pineal, shut off melatonin. If you think